Side effects of simvastatin coming up.
Sunki.
Hi everybody, it's your pharmacist Sunki here. Today we are going to be talking about rosuvastatin. Make sure you stay until the very end so you don't miss out on any important information. Everything I say today is of general nature only. It does not replace the need to see your local healthcare provider. Let me know down in the comments below what other topics you would like me to cover. If you haven't already subscribed to my channel, hit the subscribe button now and thumbs up. Without further ado, let's rock it. What is simvastatin? Simvastatin belongs to a group of medicines called the HMG-CoA reductase inhibitors, also known as statins. It is most commonly known by its brand name Zocor. What is it used for? Simvastatin is used to lower the cholesterol in your body. Cholesterol is taken into the body through food and also made by the liver. It is needed for our body to make hormones, bile, and vitamin D. There are two major forms of cholesterol: LDL, low-density lipoprotein, also known as bad cholesterol, and HDL, high-density lipoproteins, also known as good cholesterol. Too much bad cholesterol can block our blood vessels and lead to heart attack or stroke. On the other hand, good cholesterol removes the bad cholesterol from the body. Rosuvastatin works by reducing the amount of bad cholesterol made by the liver and raise the good cholesterol to reduce the risk of us getting a heart attack or a stroke. Before you start, things that you need to tell your doctor. If you're allergic to any statins that was previously prescribed to you, or if you're allergic to any ingredients listed on the leaflet of the simvastatin. Note that there are many brands of simvastatin, so if you're allergic to a certain ingredient in this brand, your pharmacist can try and find you another brand that does not contain that ingredient. If you have any liver or kidney diseases or breathing problems. If you're pregnant, intend to get pregnant, or likely to be pregnant, as simvastatin can affect the baby in your tummy. If you are a woman of childbearing age and you are sexually active and you need to go on simvastatin, your doctor will usually give you a birth control pill to go with it. And you have to let your doctor know if you're breastfeeding or intend to breastfeed. Rosuvastatin can cross breast milk and affect the baby. Tell your doctor as well if you have pain, tenderness, or weaknesses of the muscle from other medicines used to treat high cholesterol and triglycerides. Any personal or family history of muscles disorder, or have any unexplained aches and pains in your muscles. Any low thyroid hormone levels, hypothyroidism. If you're drinking alcohol regularly, as that will increase the risk of you getting side effects if you're of any Asian descendant. I know the doctor should clearly see that you are Asian, but if you are a mixed child, it's harder for some doctor to pick it up, and the dosages of Asian background and a Caucasian is different. Simvastatin can interact with many other medications, so make sure your doctor and pharmacist know all the medications you are taking. This includes any herbal supplements, vitamins, and minerals that you buy without a prescription from the pharmacy, health food store, or supermarket. Now, if you're concerned that your doctor or pharmacist might miss any interaction, remind them to double check. Now, you can always bring a list of medications to your pharmacist, and your pharmacist will be able to help you work out if there's any interactions on the medication and let you know the severity of it and let you know what to do next. When your medication list exceeds a certain amount and it's hard for your doctor to keep track on all the interactions and side effects, your doctor will request for a specialist pharmacist to review all your medication and optimize the usage of your medication. If your doctor did not initiate that, you can always request your doctor to do so. What strength does simvastatin comes in? Simvastatin comes in 10, 20, 40, and 80 milligram. How to take it? Depending on your condition, your age, your ethnicity, your doctor will decide the most appropriate dose for you. The doses of simvastatin is between 10 to 80 milligram, taken once a day around the same time in the evening. Swallow the tablet whole with a glass of water. Now, if you forget to take it, if it is almost the time to take your next dose, skip the dose you missed and take your next dose when you are meant to. Otherwise, take it as soon as you remember, and then go back to taking the medicine as you would normally. Do not take double dose to make up for the dose that you missed. This may increase the chances of you experiencing side effects. Things to be aware of. Be careful of driving or operate machineries until you know how this medication affects you. Simvastatin generally does not cause any problems with your ability to drive a car or operate machineries. However, it may cause dizziness in some people, so make sure you know how the medication affects you before you start driving or operate machineries. Avoid drinking large quantities of alcohol. Drinking large quantities of alcohol may increase the risk of you getting liver problems while you're on simvastatin. Avoid drinking grapefruit juice. Grapefruit juice can increase your chances of getting side effects. Tell any other doctors, dentists, and pharmacists who are treating you that you are taking this medicine. Tell your doctor that you are taking this medicine if you plan to have any vaccinations or immunizations, especially a doctor that hasn't treated you before. If you are going to have surgery, tell your surgeon or anesthetist that you are taking this medicine. It may affect other medicines used during surgery. Side effects. All medicines, even herbal supplements, vitamins and minerals, things you can buy without a script in your pharmacy, health food store or supermarket, can have side effects. Sometimes the side effects are serious. Most of the time they're not. You may need medical attention if you get some of the side effects. Now, do not be alarmed by the following list of side effects. You may not even experience any of them. Tell your doctor or pharmacist if you notice any of the following and they worry you. Muscle and joint pain, muscle weaknesses, especially in the forearms, thighs, hips, shoulders, neck and back. Difficulty climbing stairs or standing up from a chair, difficulty lifting arms over the head, falling, and difficulty getting up from a fall. Constipation, diarrhea, stomach pain, nausea, feeling sick, wean, nightmares, memory loss, sexual dysfunction. Now, the side effects that I've just mentioned are some of the more common side effects of this medication, but they are usually mild and short-lived. Now, you must tell your doctor immediately if you notice any of the following side effects. Yellowing of the skin or eyes, also called jaundice. Signs of anemia such as tiredness, being short of breath, and looking pale. Now, if you're a man, having larger breasts than normal, bruising more easily than normal, and painful and swollen joints. If you notice a significant increase in your need to urinate, or if you are significantly more hungry or thirsty than usual. There is a slight increase of risk of getting type 2 diabetes, and these are the symptoms of type 2 diabetes. Now, the next lot of side effects that I'm talking about are the side effects that if you experienced any of these, you need to stop the medication and send yourself to the emergency department of the hospital immediately. Symptoms of allergic reactions. This includes cough, shortness of breath, wheezing, difficulty breathing, swelling of the face, lips, tongue, throat, and other parts of your body. You develop a rash, itching, hives on the skin, fainting or hay fever-like symptoms. If you experience any unexpected muscle pain, tenderness, or weakness not caused by exercise, particularly if you also feel unwell or have a fever. If you have brown, black colored urine, there's a condition called rhabdomyolysis, where breakdown of your muscles occur. This can lead to kidney failure and death. And these are the symptoms of rhabdomyolysis. Now, the risk of muscle problems is greater for patients taking higher doses of simvastatin, particularly the 80 milligram dose. Older patients who are 65 years and older, female patients, patients with abnormal kidney functions, and patients with thyroid problems. Now, all these are serious side effects, but they are very rare. More side effects information can be found on the leaflet of the medication. I will also put a link down below for you so you have access to them. Now, even then, the list of side effects there are not complete. New side effects can pop up. So if you experience any side effects that is not listed there, you can always report it to your country's medicine regulatory agency. In the US, it's called FDA MedWatch. In UK, it's called Yellow Card. And in Australia, it's TGA. I know I've listed many side effects and I don't want this to scare you because most people don't experience any side effects, and if they do, they are the mild side effects and they're usually short-lived. I want to remind you, this is a life-saving medication. Many of my patients are on this medication for a long time and they're totally fine. And it's this medication that is keeping them alive. So if you're prescribed simvastatin, it means that the doctor deems that the benefit of the medication to keep you alive, preventing you from getting heart attack and stroke, outweighs the rare side effects that might not even happen to you. So listen to your doctor. If you are experiencing any side effects I mentioned to you, inform the doctor immediately and take it from there. Now, last note. It is great that we live in a world where we have all these life-saving medications in our fingertips. However, it is not a good thing for us to solely rely on these medications and not do any lifestyle modifications. This medication only controls the condition but does not cure the condition. Things you need to do besides following the doctor's instruction carefully to take your medication daily on time is to exercise, control your diet, reduce fat and salt intake, quit smoking if you are smoking. Now, these are very important to keep your body strong and healthy. Now, work with your local doctor and your pharmacist to achieve that. Now, I have also made a smoking cessation video. I'll put the link down below for you. In this channel, I've also made other medication and health-related videos to help keep your body strong and healthy. It is a growing library of medication and health information. Besides a pharmacist, I'm also a singer-songwriter, music producer, and an actress. If you're interested in knowing my other life, check me out on my other videos in my other playlist. Now, if you haven't already subscribed to my channel, hit the subscribe button now and thumbs up and follow me on Facebook and Instagram. My handle is @SunkiOfficial and it's your pharmacist Sunki here with lots of love. See you around.